Heart health is a very important part of our overall health. A healthy heart improves the quality of life as well as increasing our overall life expectancy. I want to impress on you the importance of a yearly checkup as well as becoming physically active to improve and maintain heart health. I point out that heart disease is ranked as the #1 cause of death in the United States. However, the heart we want to examine today is Collins Middle School. We are the heart of the community that we serve. With this thought now on your mind, I would like to share some very important information on the current condition of that heart, its strengths as well as its weaknesses. The main objective of this presentation is not to only examine this heart's current condition, it is to set goals that we can work together on to improve its health and to maintain a strong school health index with routine exercise and a coordinated effort. By working with this board, the overall health of Collins Middle School and all schools in Fayette County can improve. We are CMS and we are committed to maximizing student success. The Centers for Disease Control and Prevention's idea of whole school, whole community, whole child model expands on the 8 elements of a coordinated school health plan. Healthy students make better learners. It has become essential that the 8 components are in place and been reviewed and evaluated. By working together, we can provide for better health outcomes for our students, staff, family, and the communities we serve. We will take a brief look at these 8 components. School health, safety, and the school environment include a healthy and safe school. This includes the physical buildings and the grounds that are to be well maintained and safe from anything that is detrimental to the health of the students, staff, or anyone else involved. Also included is the psychosocial environment that can affect the well-being of the students and the staff. Transportation to and from school is also an important part of this particular element. Health education should provide students with opportunities to acquire the knowledge and skills to become health literate. Health education will assist students to live healthier lives, be more productive students, as well as citizens. It should be taught by qualified, certified, and trained health education instructors. Physical education is a school-based opportunity for students to gain skills and knowledge for lifelong participation in physical activity. Along with the normal physical education class, the school should also provide a setting with opportunities for students to be active outside of that class time as well. Physical activity is an important part of their lives, and all opportunities should be provided that is possible by the schools. The Nutrition Services Department should provide a variety of nutritious and appealing meals for all students and staff. It is also important to promote healthy eating habits through brochures, pamphlets, and posters throughout the cafeteria and school area. The school nutrition service should be overseen by a qualified child nutrition professional at all times. Health services are what is usually referred to in most school settings as the school wellness center. It is designed to meet the many physical needs of staff, students, and family. It is made up of full-time medical staff that is there to provide these services during all normal school hours and also to be in place in case of any emergencies that should occur during the normal school day. The school counseling, psychological, and social services is a 3-part system that should be designed to meet the mental, emotional, behavior, and in some cases the physical needs of the students. It should also play a key role in overseeing the health of the school's climate and environment. An area that could use work in most schools is health promotion for staff. This particular area should be able to provide wellness checks for staff on a yearly basis. Along with that, there needs to be offering stress management programs due to the enormous amount of stress placed upon teachers and other staff members in today's world. Also, a goal should be provided to provide for physical activity for all staff members that is easily accessible and user-friendly. The last area we'll look at is family and community involvement. This does not put it in last place, however, as it's a very important part of a coordinated school health program. The involvement of family and the community is important to enhance the overall health and the learning of all students at Collins Middle School. Using the School Health Index Assessing and Planning Guide provided by the Center for Disease Control and Prevention, we have taken a close look at each component to gain an idea of the strengths and weaknesses in the 8 areas. We are able to determine areas of need as well as the overall health index of Collins Middle School. This assessment has provided a basis for what we need to do to improve our overall school health program. The graph tells us that staff health promotion is our weakest area and our school health services almost at optimum strength. But again, our main objective is the overall health. With all the scores averaged together, we have an overall health score of 68%. To avoid an initial negative mindset based on that 68%, a look at our strengths will help us to know that numerous parts of each of the 8 components are in place and working well. And even more encouraging is that several of these strengths are resources as well, and will be vital to our plan of improving the overall school health at Collins and other schools around the county. A positive attitude will bring about this change. We help students to overcome learning barriers they may face or have. All education is well planned out. There's a focus is put into the character education of our school by addressing issues such as harassment, bullying, and other social skills. Professional development is offered to all staff to help them to understand and gain awareness of sensitive issues such as harassment and suicide. Active supervision is in place during the school day to reduce problems that can arise when students are left unattended. The Health Education Department has credentialed teachers available to teach the standards and the curriculum provided by the state. The state offers content standards on health education that is in alignment with nationally recognized standards to drive a sequential health curriculum. All this should have us to start feeling better by now as the list grows. We also offer free breakfast and lunch to all students. There's adequate time set aside for these meals to be eaten. Nutritional service managers are credentialed to meet the needs of the students and the cafeteria staff into the promotion of healthy food and beverage choices as they are presented to the students. The Wellness Center is fully staffed to offer a multiple of service to the students, staff, and the community. With the recent onset of asthma throughout the world, we have a plan in place for students who suffer from this condition. An emergency response plan is in place and practiced from time to time. As stated before, resources are vital to our success, and we have the resources. Counseling services are able to assist students during transitions in their lives, like divorce and unplanned movements. We're able to refer those in need to specific help when that need calls for it. Students with emotional, behavior, and mental needs are identified and given assistance as needed. Tobacco use policies in place with cessation programs for both students and the staff alike. Staff are able to get comprehensive yearly exams as preventive measures to ensure wellness throughout the year. Professional development programs offer first aid and CPR training to all staff to be ready when the need arises. Work is always underway to have parent and community involvement take place. Such programs as the Devil Dash, Literacy and Physical Activity Nights, our Watchdog program, and the use of our Parent Advisory Council are good examples of this taking place. We're using technology in the school throughout our website as well as our live grades to keep parents informed as to what's going on a daily basis. We've now had the opportunity to look at our strengths, so now we need to look at our weaknesses and ask the question as to why. We have no school health coordinator in place. This is going to be a critical component, as we know from knowledge that everything rises and falls upon leadership. Once that's put into place, we would need an effective health committee or team in place to start all the 8 components working together. At this time, there's a lack of professional development to train staff in meeting the diverse needs of our students on a daily basis. Health education has been taken out of the classroom and tied in with the physical education program, overburdening both. Student-teacher ratio in the physical education classes is unacceptable in the amount of space available. Mixed grade levels in physical education classes make for unrealistic lessons on content, and busy, happy, good is not a quality physical education program. Also, is limited activity on the outside of the physical education program due to limited space and time. It's important that we understand we must know our weaknesses if we want to move forward. Our current cafeteria is undersized and outdated. This would be a very enormous task to overcome at this time. However, other things can be done. We have a limited collaboration with the Wellness Center and all other components of the Coordinated School Health Plan, such as the Health Education Department and the Physical Education Department. Our staff has no resources for stress management. There's no facilities available that are easy to access and user-friendly for them to participate in physical activity to improve their overall health as well as their stress levels. There's limited parent and community involvement. Even though numerous ideas have been tried to improve in this area, we still have a difficult time getting all the components together needed. But remember, it's our strength that will grow out of our weaknesses. So what is the plan? You ever feel like the guy painted up into the corner with no way out? You got yourself there and you're not sure how? We know our strengths and we know our weaknesses. It's time for us to form a plan if we want improvement. The plan must be a well thought out plan. It has to be put into action. We've got to stop and review it from time to time, and it's always got to be under constant evaluation if we're ever going to get out of the corner and not put ourselves back into it again. One of our most essential areas for school health, safety, and the environment is going to be to put leadership into place. We must form a school leadership made up of a school health coordinator. Once that takes place, we'll need to put together a team with the 8 areas to meet on a regular basis to assess, plan, review, and evaluate in order to ever achieve any success in the school health, safety, and environment. Our school health education program has all the resources it needs to make it a valuable and asset to our program. We need to set a time aside for health education in a classroom environment. We need to make sure that we have a classroom that is set up for health education only to meet the needs of the students, to be designed in a user-friendly way to meet those needs. Also, technology needs to be in place in that particular classroom, as technology will be a vital part of the health classes to use to gain health literacy over the coming years. In order to meet the needs of the students in the physical education and other physical activity programs, we need to get our student-teacher ratio back down to a safe and productive size. Also, the mixing of grade levels during the same time frame in the same gymnasium should be unacceptable, as the content, standards, and objectives that need to be taught on each individual grade level cannot be accomplished in this setting. It would be important that we take our adapted physical education program and also bring it in on its own separate time frame to meet the needs of those students with special needs in regard to their physical activity. As pointed out earlier, our nutrition services scores really well. We do a good job in this area with limited needs. However, there is a large amount of waste food that is just thrown into the trash each day. We need to educate our students as to the importance and the value of good quality food to try to avoid this situation. Also, we should consider a method of recycling as to allow that food to go to local area farmers for the possible feeding of livestock to help decrease the cost and to improve the quality of what our program offers. As pointed out earlier, the health services or the wellness center is one of the highest scoring areas within our school index report when we assessed it. However, it tends to set off by itself with no collaboration among the other parts of the school and the community. It would be a valuable asset with the leadership to bring this part together. With collaboration between the health education, wellness center, and physical education department, we'd be able to meet some of the needs of special students that have special needs in weight management as to work together to reach that goal. Our counseling, psychological, and social services department is doing a good job, but once again we lack in one essential area. Our psychological area is lacking. We'd possibly work with some of our outside agencies to offset our limited psychological services. Also, being able to share information among the 3 identities without violating student confidentiality would be of a bonus. Create a method of tracking students with emotional, behavioral, and mental needs, as to sometimes we meet them and then we lose sight of them there shortly after. Joining forces with our local law enforcement to assist with students involved in violent situations, be whatever they are, is a plan that we have in the near future. One of our weakest areas in our school health index was our staff health promotion. We have no stress management resources in place for our staff, along with no professional development in this particular area. Also, with the use of our facilities always being full, there's never any opportunity for the staff to participate in physical activity upon the campus and grounds. It would go a long ways if we were able to provide an area that was user-friendly as well as easily accessible for all staff members to participate in physical activity to improve their overall wellness as well as to help reduce stress. It would also be possible to add an incentive program for those who decided to choose healthy lifestyles over the existing lifestyles that they may be practicing. Another area that we need involvement is our community and parent involvement plan. Within this 8-step program, this is critical to our success at Collins Middle School, and we need you to become involved. We need to make it easier on our end for parents to be involved during normal school hours. We also could come out and work with resources in the community to possibly help offset some shortcomings in our staff. Physical activity nights with all the family involved would be a good idea to bring us together and to provide physical activity outside of our normal programs. Also, it's a possibility that we could bring professionals in from the community to share with students some possible careers or goals that they may have and want to achieve. So we pretty much have a plan, but it's going to take a coordinated effort to improve the health index at Collins Middle School. First and foremost, we're going to have that effective leadership. We're going to have a team effort in order to assess, to plan, to review, and evaluate. With a lot of work and the willingness to do this by all members involved in the 8 components and a chance to collaborate, when it's all completed, there'll definitely be a time to celebrate. Collins Middle School is the heart of the community that we live in and work in every day. It's important that we support our coordinated school health program to maintain a good, strong heart in this area. We ask all involved to make plans, to work with us as we try to put a strong plan into place to maintain good heart health in our community.